The most important detail in Neuralink's first public success story is not that Noland Arbaugh moved a cursor with his mind.
I love playing chess, and so this is one of the things that y'all have enabled me to do, something that I wasn't able to really do much the last few years, especially not like this. I had to use like a mouse stick and stuff, but now it's all being done with my brain. If y'all can see the cursor moving on.
It is that the implant partly failed and still kept working. Neuralink later said some of the flexible threads in the M1 implant retracted from the brain. Fewer working electrodes meant less signal. The company changed the decoder and interface, and Arbaugh's control recovered. That is the real story. Not magic, not mind reading. A fragile medical system being pushed from a lab demo toward everyday use. Neuralink is the loudest company in the room, and for good reason. Its N1 implant uses 1,024 electrodes across 64 flexible threads, inserted by a surgical robot called R1. The PRIME trial is an early feasibility study for people with tetraplegia from spinal cord injury or ALS. But the key word is early. Clinicaltrials.gov lists years of follow-up. This is not a consumer product launch. It is a safety and function trial. The public demo matters because it shows a fully implanted wireless system can give someone computer control. But the engineering problem is much bigger than the viral clip. The implant has to stay stable. The signal has to stay usable. The software has to adapt when the body changes around the device. The other mistake is treating Neuralink like it invented the entire field. Years before the first Neuralink human implant, BrainGate researchers and Blackrock Neurotech's Utah array ecosystem helped show that signals from motor cortex could control robotic arms, tablets, and cursors. In 2012, a Nature paper showed people with tetraplegia controlling a robotic arm. In 2008, BrainGate participants used cortical signals to operate a tablet. In 2021, researchers reported home use of a wireless intracortical BCI system. That history matters because it changes the story. The question is not whether brain signals can control a computer. That has been proven in small, carefully supported studies. The question is, who can turn that proof into durable medicine? Synchron is trying a different bet. Instead of opening the skull and placing electrodes into brain tissue, Synchron's stentrode is delivered through the blood vessels. The idea is to place an electrode array near motor cortex from inside the vascular system. Thomas Oxley's company has already run small human studies, including switch and command. The attraction is obvious. If a brain-computer interface can be implanted using a familiar neurointerventional route, it may be easier to scale than a penetrating brain implant. But there is a trade-off. Less invasive may also mean less signal. A device inside a blood vessel is not sitting inside the same neural tissue as a Utah array or Neuralink thread. The field is not just racing for the best demo, it is racing for the best compromise. Then there are the companies trying to split the difference. Precision Neuroscience, co-founded by Benjamin Rappaport, is building the Layer 7 cortical interface. It is a thin, flexible surface array designed to sit on top of the cortex instead of penetrating it. Precision says the array has 1,024 electrodes over about a postage stamp-sized area. In 2025, the company announced FDA 510(k) clearance for recording, monitoring, and stimulation on the surface of the brain for up to 30 days. That is important, but it is not the same thing as a chronic take-home BCI for everyday communication. Paradromics, led by Matt Angle, is pushing a different high-channel approach with the Connexus BCI, aimed first at restoring communication for people who cannot speak. It's Connect. One study is an early feasibility trial. So the map is clearer now. Neuralink, Blackrock, and Paradromics chase high-resolution invasive signals. Synchron chases a vascular route. Precision chases a surface grid route. Nobody has won yet. Here is the cleanest way to separate proof from hype. Proven. Small numbers of people with paralysis can use implanted brain signals to control cursors, tablets, robotic arms, and text systems. Also proven in research settings, attempted handwriting can be decoded into text, and attempted speech can help drive text, synthesize speech, or an avatar. Stanford's 2021 handwriting work and UCSF's 2023 speech neuroprosthesis are not fantasy. They are serious clinical research. Not proven that millions of healthy people are about to get brain implants. Not proven that these systems can read private thoughts. Today's medical BCIs are usually decoding trained, task-specific signals. Move the cursor, click, attempt speech, attempt handwriting. That distinction matters. Overhyping the technology can scare people for the wrong reasons and hide the real ones. The future of brain implants may be decided by problems that are not very cinematic. Can the electrodes keep a clean signal for years? What happens when scar tissue forms, a thread shifts, a battery ages, or a company changes the software? Who pays for implantation, support, upgrades, revision surgery, and removal? And then there is neural data. No, these devices are not reading your secret thoughts, but movement intention and attempted speech are still deeply personal. If a person depends on a decoder to communicate, then updates, cybersecurity, data policy, and company survival become medical issues. A failed app update is annoying. A failed communication implant can be life-altering. That is why the real brain implant story is bigger than Neuralink and more interesting than the hype. This is medicine trying to become a platform. The next decade will decide whether that platform gives people agency or makes them dependent on systems they cannot control. The brain implant era is here, but only for a tiny group of people who need it most. The demos are impressive. The trials are early. The stakes are human. Follow the evidence, not the miracle story.